$2,435 a year. That's what Medicare Part B takes out of your Social Security check. Nothing inside Part A or Part B is allowed to help you pay it. Not won't, not allowed. My 82-year-old dad, Wallace, is a Vietnam-era veteran. He found the one thing Medicare's own handbook admits is allowed to help. Today, I'm counting down 9 things Medicare Part A and Part B are not allowed to do. Number 1 costs veterans more than the other 8 combined. By the end of this video, you'll know what Dad knows. Here's what nobody tells you about original Medicare. When Part A and Part B don't cover something, it's not because Medicare decided to say no. It's because the law says Medicare is not allowed to say yes. These rules were written in 1965. Most of you were kids. Congress wrote the rule book, locked the doors, and never came back. 60 years of veterans have retired into a rule book that was never written with veterans in mind. So every item on this list isn't a gap. It's a rule, written down. 60 years old. Let's count them down, smallest to biggest. Number 9, a gym membership. Part A and Part B are not allowed to pay for one. Doesn't matter what your doctor says about staying active, not allowed. Number 8, an over-the-counter allowance. The aspirin, the vitamins, the cold medicine you buy at the pharmacy without a prescription. Part A and Part B are not allowed to give you $1 toward any of it. Not allowed. Small items, I know they get bigger from here. I'm Chris Duncan, and I've been helping retirees with Medicare and retirement planning for nearly 20 years. Our organization focuses on veterans, and this is the list we walk through on almost every call, because almost nobody has ever seen these rules laid out in one place. Back to the countdown. Number 7, hearing. Routine hearing exams, hearing aids. Part A and Part B are not allowed to cover them. Think about that. Hearing aids run thousands of dollars a pair, and the program you paid into your whole life is forbidden from touching the bill. Not allowed. Number 6, vision. Routine eye exams, eyeglasses, contact lenses. Number 5, dental. Routine cleanings, fillings, dentures. The big one that hits almost every veteran over 65. Part A and Part B are not allowed to cover routine dental. Not allowed. Hearing, vision, dental, the 3 things your body needs most after 65. The 1965 rulebook forbids all 3. Number 4, your prescriptions. The medications you pick up at the pharmacy. Part A and Part B are not allowed to cover most of them. That's why Part D exists as a separate program, because the original rulebook forbids it. Not allowed. Number 3, this one surprises everybody. Coverage outside the United States. In most situations, if you get sick or hurt in another country, Part A and Part B are not allowed to pay. You take that cruise. You visit family overseas. You cross a border. In most cases, Medicare stays home. Not allowed. Number 2, and now we're in the serious money. Part A and Part B are not allowed to put a yearly limit on what you pay out of pocket. Page 11 of the 2026 Medicare and You handbook says it plainly. With original Medicare, there's no yearly limit on what you pay out of pocket unless you have supplemental coverage. Read that again. No limit, a bad year with deductibles and that 20% coinsurance, and there is no ceiling. No number where Medicare steps in and says you've paid enough. The rulebook is not allowed to protect you with a cap. Not allowed. And number 1, the one that costs veterans more than all the others combined. Your Part B premium, $202.90 a month in 2026. $2,435 a year, straight out of your Social Security check, and nothing inside Part A or Part B is allowed to help you pay it. Now, if your income is low enough, your state has help for that premium. That's real and it's worth checking, but look at where that help comes from. It comes from Medicaid, a completely different program, because even the government's own premium help had to go around the rule book. Nothing inside Part A or Part B is allowed to touch that bill. You pay it every month, and that's if the premium never goes up. The premium goes up almost every year. Over 20 years at today's rate, that's roughly $48,700. And the rule book says Part A and Part B are not allowed to help with any of it. Not allowed. 9 rules, 60 years old, all of them forbidding. So here's the question. If Congress locked those doors in 1965, did anybody ever build another door? They did. In 1997, Congress wrote a new set of rules, Medicare Part C. And here's the sentence this entire video has been building to. Medicare Part C is allowed to do things Part A and Part B are not allowed to do. Medicare Advantage, also called Part C, plays by a different rule book. Part C is allowed to provide benefits that go beyond what original Medicare provides on its own. And Medicare rules allow Part C plans to have premiums as low as $0 per month. Now hold on, $0 doesn't mean free. Nothing about Medicare is free. You already paid for it. FICA came out of every paycheck you ever earned. Military service, civilian jobs, didn't matter. And your federal income taxes paid in on top of that year after year. A $0 premium isn't a handout. It's what you already bought finally showing up. But here's what you need to know. To be eligible for Part C, you must have Medicare Part A and Part B. You can't skip Part B and get Part C. Part A and Part B are the foundation. And your VA benefits? Part C plans are not allowed to change your VA health benefits in any way. Your VA benefits stay exactly the same. Now, number one on that list, your Part B premium, even that one has a door on page 11 of the 2026 Medicare and You handbook. The same page that admitted there's no yearly limit. It says about Medicare Part C plans. Some plans may have a $0 premium and may help pay all or part of your Part B premium. It's Medicare's own handbook. The thing Part A and Part B are forbidden from doing. Medicare's own pages say some plans may do. The thing Part A and Part B are forbidden from doing. Medicare's own pages say some plans may do. Let me show you what that looks like in real life. My dad, Wallace, 82 years old, Vietnam-era veteran, he uses the VA, and we're happy with the care the VA gives him. Last year, Dad called me, Chris, they won't cover it. He needed a procedure. The VA said the procedure wasn't medically necessary, denied, 82 years old, and the system he served said no. But Dad had a Part C plan. His plan covered the procedure. No arguments, no appeals, no stress, no waiting. Dad's VA benefits didn't change. VA benefits can't be changed by Medicare Advantage. Dad said it best. Chris, the VA is great, but it ain't perfect. And here's Dad's Part B situation. Dad's Part C plan costs $0 per month. Dad is not receiving any low-income subsidies, and because of what page 11 describes, Dad gets $185 of his $202.90 Part B premium covered. Dad pays $17.90 a month for Part B, not $202.90. $17.90. And Dad is not the only one. Now the disclaimer, and I mean every word of it, Dad's $185 is the highest available in his county. That does not mean $185 is available in your county. It does not mean this benefit is available in your county at all. Some counties have plans with this option. Some counties don't. Every county is different. Every plan is different. The amount is different. Benefits and costs vary by county and plan. One warning before the finish. None of this works if you skip Part B. Skip Part B and the late enrollment penalty is 10% for every full 12 months you delay. That penalty is permanent for life. And it's a double whammy. The premium goes up and the penalty goes up. The rulebook punishes waiting forever. 3 veterans, same age, same Part B premium, 3 different outcomes. Veteran 1 listened to bad advice, skipped Part B for 5 years, now pays a 50% penalty every month for life. And that's if the premium never goes up. Veteran 2 enrolled in Medicare but never learned what you just learned. Pays the full $202.90 every month. Covers every item on today's list out of his own pocket. No cap protecting him. Veteran 3 knows what Dad knows. Enrolled on time. Looked at what Part C is allowed to do in his county. Medicare Advantage working harder for him. His VA benefits didn't change. Same age, same Part B premium, 3 completely different outcomes. Which veteran are you going to be? 9 things Part A and Part B are not allowed to do. 1 rule book from 1965, and 1 sentence that changes the whole game. Medicare Part C is allowed to do things Part A and Part B are not allowed to do. I wrote the book on this, literally, Medicare for Veterans, the Complete Field Guide. If you want to read my book for free, scan this code with your phone right now. It'll take you straight to freevetsbook.com, or grab a copy on Amazon. You earned Medicare. Part C can make Medicare work harder for you. You're seeing two videos on your screen. The first one breaks down the $2,435 coming out of your Social Security check every year. The second one shows you the one Medicare mistake that cost veterans $8,880. Both are worth your time. I'm Chris Duncan. We speak veteran.